Ashish, you've been a medical doctor in respiratory medicine for what, 30 years now? Curious to hear what drew you towards that field in the first place.
I don't know. I've always wanted to be a doctor. It's really strange, Patrick. I think since the age I can remember being 80-year-old and being lined up in two lines, and all the kids, all the boys wanted to be footballers. And the teacher came to me and said, "What do you want to do?" And I just said I wanted to be a medic. I don't know where I said that from, but I just did. And it's always, as young children, you always want to be astronauts and stuff like that. But I've always been drawn back to that passion. And it was really amazing that I got into university to do this career. I've done loads of different things. I wanted to be an obstetrician in the past. It was one of my first processes, but I had an amazing consultant in my first job who inspired me to be a physician. And from there onwards, I fell in love with respiratory medicine. The ability, to focus on well-being through your breath is kind of like, seems simple. Everyone breathes. You need to breathe to live. It's a process that we do and we're aware of. We're aware of it when we're exercising a lot, but not everyone does it efficiently. So it was kind of like that process. And also, just a backstory, my father had severe asthma. So when we were growing up, Dad was in and out of hospital a lot. He was intubated in intensive care. So I suppose probably psychologically, it probably had an impact on me. But yeah, I can't really pinpoint a moment in time apart from that 8-year-old's initial uh, discussion with the teacher that really pushed me forward.
Yeah, I imagine also, as you mentioned, having personal experience of what it's like when it's difficult
Hmm.
to breathe plays a role, at least in my case, that helps. I'm curious, like, given that there's been probably some progress also in how we understand and treat different respiratory conditions. What's been the biggest change if you think back, like to when you started your as a physician to now in 2025?
So just science is amazing. That's what I've discovered. If there's anything I've discovered from being a medical student to where I am now, is that actually trust in good science is really important. Mm, So, so I've come from an era where when I first qualified and, we had individuals who have severe asthma or COPD, and people would accept that that's their life. They would be on steroids, really, and, obese because of steroids, develop diabetes, sleep apnea and stuff like that. And now, if I look at the intervention of science, um, and especially the medications we have, kind of like precision medicine, that that actually takes this most severe individuals with death-defying disease and actually makes, through simple injections with very little side effects, makes their life's normality from a breathing perspective. And that I see that in all aspects of, you look at cancer treatments where once upon a time people used to have chemotherapies, and nowadays biological agents and monoclonal antibodies have revolutionized some parts of treatment. I think what's really interesting currently is the involvement in technology. So stepping outside medicine to understand how tech and understanding of what normality is, and whether there's subclinical disease, and whether you can at a younger age understand maybe limitations you may have and actually work with them before needing to go on medications may be important. So I think one of the things that we've never explored in huge amounts is technology within respiratory medicine. Well, surely we've had, bronchoscopies to look inside lungs and CT scans and MR scans. Those are diagnostic tools, but we've not really ever had tools which facilitate outcome in personal life. We've now got Apple Watches. If you look at the Apple Watch, the amount of probable data that's gone in to find that mindfulness where you take your deep breath in, hold your breath and breathe in and out for a minute every hour, which actually slows everything down. I think so. In my life, I've seen medicine change dramatically from where it was very reactive, where it was very limited, to the future. I'm slightly envious of the next generation because the medicine that they will undertake I hope will be more preventative than treatment wise, but I think the instigation of, I don't know, the science around medication, which reduces side effect profiles, but also technologies which inform the general population of how to stay healthier, is going to be really important, I think, going forward.
Yeah. Yeah, I can imagine. As you probably recall, my previous life was in the field of personalization for commerce, and I guess part of that premise was always like it's something you can take also into the world of healthcare and start personalizing. And now it feels like we're going to moving towards that direction where there's more inputs that you can feed into an algorithm to derive what is the right personalized output, whether it's, as you mentioned, medicine or actual more technological interventions or even behavioral interventions that are tailored to you. So, yeah.
So historically, medicine's been about being told what to do, isn't it? You need
Mm,
an operation, you need this. But actually, it's your life, isn't it? It's your choice. It's your ability to understand. And most individuals are intelligent enough if you're given data or you're able to understand data effectively and you're given it in a usable form to actually make sensible decisions for yourselves. And, we do that, when I see my patients in my clinics, I always, at part of that discussion or even at the start of the discussion, always say that just because we can do stuff as physicians for them, that's not always the right thing for those individuals. At the end of the day, it's a personal choice. It's the life you lead and such like. So my hope and aspiration is as time goes on, that we have a bit more ability to be pre-informed as individuals, because I'm a patient as well. Maybe a doctor, but outside my care processes and my interest processes are outside respiratory medicine. If it was something else, I would be that patient, and I would like to have the ability to understand the illness and the process around how I can make recovery occur better if there's something gone wrong. Yeah, so I think you're right. I think personalization of healthcare is important for everyone.
definitely want to go deeper into the technology
And
in
I
a
would go
moment, but
one
maybe,
deeper.
yeah, please.
Yeah. I'd go one more deeper rather than just knowing when you're poorly, knowing when you're well and it means to be well.
Yeah,
So
what it looks like.
individuals who, yeah, exactly. So individuals who do 10Ks or doing couch to 5K, kind of like, have watches, tell them heart rates and stuff like that. But actually understanding, how much you can push yourself safely and what to do to try and get yourself better would be an amazing thing, wouldn't it? You can imagine the impact on longevity and well-being, because being healthy is part of not just for today, it's where you are in 20, 30 years' time. The healthier you are now today, the likelihood is the healthier you're going to be and less dependent on other people until, when you're 70 and 80 years old, for example.
Yeah, it's like the gradient of decline. You can change both the curvature of the gradient and the level at which you start the decline. So it's a good point. I thought actually, because you're one of the best people to ask some of these basic questions about defining a few things, which are thrown out there, but they're sometimes like ill-defined, including breathlessness and a few others. But you led it, I think, at NHS, right? The severe asthma and breathlessness, a complex breathlessness unit. Maybe we start with just like defining what those are. Like, what is in practice asthma? Like, how do you define that?
So the first thing is asthma is not a single disease. Asthma is multitude of different pathways within the body that go wrong. It's an inflammatory process. The way to look at it is it's an inflammation, a wildfire in your lungs. The lungs are angry and red. And rather than feeling pain, so if you hit your thumb with a hammer, it gets swollen and you get pain. But rather than having pain, your lungs twitch. But your lungs are swollen. They very often exude kind of like nutrients and fluid. So you have a cough, which is productive of mucus sometimes when you've got an exacerbation. But even at steady state, if you're an asthmatic, your lungs are red and inflamed. There are multiple different types of asthma. So we call them phenotypes. So the way that patients present and the types of, you have patients who are allergic, patients who have no allergic component to the asthma, but are, for example, exercise induced or are viral induced. So, and they have different internal pathways which lead to the same road, if you like, of inflammation and twitch in the lungs. So the way to So if you have an asthma attack, your airways really shut down. They narrow. So, and if you go back to basic physics, if you half the radius of a cylinder, the resistance to airflow in that increases to the power of 4. So by just narrowing your airways, the amount of difficulty in breathing becomes really severe. And the amount of energy you use up in breathing, the potential for exhaustion becomes more significant. Now, if you've got chronic asthma or low level asthma, you just work harder than everyone else and you're more tired and you're able to achieve less physically and in a day to day manner. But the panacea for everyone is to have normal, large open airways all the time. So from our perspective, when we see patients with asthma, what we're trying to do is just ensure that the airways are non-twitchy and the inflammation's gone. And the best way to look at asthma for anyone is narrowed, inflamed, twitchy airways, which are reactive to inhaled particles.
I think often, at least in my personal experience, you kind of correlate usually uh, wheezing in your lungs with asthma. But is it that way? So, like, is a wheezing always asthma, and vice versa? Is asthma always with wheezing sounds, or not always?
So it's difficult, isn't it? So the most significant asthma acute attack, and we talk about life-threatening asthma, your wheeze disappears because your airways are so tight. The reason you wheeze is flow through the airway, which is normally laminar, becomes turbulent, and you produce noise. It's a bit like a reed on a wind instrument. You press it down, you narrow it, and you produce turbulent flow. You produce sound. And very much what wheeze is narrowing of your airways to produce sound. But actually, your lungs are quite complicated pieces of tree. So I always say to my patients, think about your lungs as an upside down tree. You have your trunk, which is your trachea. You have the big branches that go to the left and right lung, and then you've got the middle-sized branches which go to the upper lungs, middle lungs, and lower lobes. And then they branch and branch and branch until you end up with the terminal airways and the leaves, which are the alveoli. And the alveoli are important because that's where the job of the lungs is done. Oxygen goes into your bloodstream, and oxygen's important because it's basically the battery for everything we do, whether we think, whether our heart beats, whether our kidneys work, everything. So wheeze occurs very often when your large airways are done, but we do have patients who just get breathless, and they seem to have more peripheral, more distal asthma. And that distal asthma very often doesn't cause as much of a wheeze. It's what we in respiratory medicine call the silent zone. It's hard to investigate, but we know it exists, and we know response to treatment does improve the outcomes.
Makes sense. So it basically means that wheezing probably increases your chance of having asthma, but the fact that you don't have it doesn't mean that you don't have the asthma condition in your lungs, basically. And at a side note, you know this already, but obviously the alveoli, reading about them in the first place some time ago, kind of how like these magical little things that are transforming CO2 into oxygen and vice versa was like what inspired the name of the company. So that's it's really cool what magical things we have inside
Yeah,
ourselves.
absolutely. The importance about asthma is that it's not purely a child's disease. It occurs at different times in your life. My oldest patient today, who's had first time asthma diagnosis, was 92. The average onset of asthma is in early middle age or in your late 30s. And children do have asthma and they grow out of it. So asthma is a different thing. And then patients are different. Some patients sense and perceive asthma much more severely, and some patients are what we consider low sensors of asthma. So they can have really severe asthma symptoms and they perceive it as normal. Personal perception of breathlessness is really important in asthmatics. And very often as medics, we look at severity. And actually some of that severity is defined by people's perceptions of what their asthma is. So we can get patients who we consider severe asthmatics initially because they're on steroids all the time. But actually, when you look at it, the lung physiology and stuff like that, it's not severe. And actually education around that's important. But then the more worrying side of it is that the people who sense and perceive their asthma as not severe, and it is. So
Mm.
actually having an ability to assess that yourselves is really important. And currently it's, we use things like peak flow machines and such like. which have their uses, but it's not, it's not the right thing for everyone because, as we say, asthma occurs in a variable state in your lungs. So some people, the large airways shut down. In some people, it's more peripheral. These individuals very often don't wheeze, but get breathless and quite limited in what they can do. So, and that's again where we need the ability for individuals to understand and assess what's going on in themselves a bit more effectively than we currently do. So the ability to have technology and be involved in that's great.
Maybe you mentioned the word breathlessness. That's another word that's thrown out quite easily. People are like, "Oh, I became breathless." I was like, walking up the stairs, and I think a lot of people correlate that with basically being, not fit. But it feels like, at least in your clinic, which I'm happy to talk about in a moment, we have athletes that have breathlessness despite being at the peak of their performance in their athletic pursuit. Again, how do you even define breathlessness?
So everyone gets breathless. Breathlessness is normal. It's if you're an elite athlete and you finish a marathon, you're a marathon runner, they kind of like fall to the floor. They're exhausted. They run out of all nutrients. They've got high lactate and their respiratory rates are huge. So breathlessness, first thing people need to know is breathlessness is normal, but it can be limiting in individuals. And one of the things that we always talk about for example, in athletes and young individuals is whether your breathlessness is disproportionately more significant to your physicality. So if you feel you can keep on going, but it's your breathing that stops you during exercise, then that's something that we need to realign and assess. Sometimes it isn't. Sometimes breathlessness is because of deconditioning. So if you've been really unwell for a while, you don't have to have a respiratory disease, but as you exercise, your muscles are weaker. You have to carry your skeletal body. You kind of like go from an oxygen enriched environment in your muscles and your heart and such like to an oxygen poor environment, a lactate high environment, and you start getting breathless. Um, so, so breathlessness is a multitude of reasons for it. Your lungs are one of the most predominant causes, but muscle fatigability is one. The functionality of your heart is another. Psychology is another. You and I know that sometimes when there's a moment of importance in your life, you kind of like feel that your breath is uncontrolled, or you cut, but when there's a moment of importance and you still your breath, you control your breath, everything else improves. So breathlessness is a multitude of things, and it's very different for everyone that comes and sees us. Um, so, and what the important thing for clinics like ours is to understand what is physiological breathlessness. So actually, there's no particular disease process. It may be a conditioning issue, a biomechanical issue. So what I mean by biomechanical issue, breathing is a complex procedure. You breathe through your nose or sometimes through your mouth. You have to pass this thing called your vocal cords, your voice box, which is if you like, the door, the entrance to your lungs. And it needs to be fully open, not shut down, because if it is, then it becomes hard to breathe. And then you need to have a coordination of your in-breath to your diaphragmatic breathing, and your diaphragm's a big muscle, so they have to work effectively in coordination. So there's a lot that can go wrong. And actually, sometimes just resetting how you breathe, functionality, there's nothing wrong with your lungs, but your voice box is narrowing, your breathing pattern is asynchronous, and helping that and to understand that occurring is really important. And at the moment, we're limited by physiotherapy and assessments when people are breathless. We don't actually have the portable technology to define that at the moment, but we do understand there are symptoms for that. And then obviously there's pathological breathlessness, which is related to disease processes such as, asthma, COPD, fibrosis of the lungs, and related to cardiac disease. And then there is psychological breathlessness, which is really important because actually coordination of your breathing and delivery of efficient oxygen to your body is really important to deliver outcome.
Yeah. I'm
And I'm not
curious
sure
because,
that answers your question, what breathlessness is, because
yeah,
it's not about feeling. I think for everyone, it's just about feeling breathless, isn't it? You feel breathless, but actually there's a multitude of causes, and actually it's a different thing for different people. It's like daffodils and roses. the flowers.
Yeah, makes sense. Maybe one thing that could help even more pinpoint kind of what we're talking about, like you have the elite breathlessness clinic where I believe you have both pro athletes and kind of more weekend warriors. If we maybe talk about both, like I'm not sure if you can name names, but if you could give an example of someone, maybe the sport they did and what was the kind of, what did it look like when they walked into your door and what happened next?
Elite teams are really very careful about who we talk about and don't. But what we do, so for example, we do loads processes in our elite breathlessness clinic. We do screening. So, for example, we screen for some of the most significant Premier League teams in our country. The reason we screen for them is that there was a really seminal paper by John Dickinson, who's a professor of physiology in South England, showing that 1 in 10 Premier League footballers have subclinical asthma. So they don't know they've got asthma. They've got amazing engines they can play, but actually John did the study with his team, and actually by doing basic assessments, picked them up, treated them, and actually their performance improved significantly. And one of the things I was asked by one of the Premier League teams next to us is, what happens if their performance improves? And actually one of the things we discovered was, when actually within John's paper, was that actually the performance was improved, and actually there was a 20% improvement in some of those individuals. So actually by just treating something that they didn't even sense, but was there, was limiting how hard they could work, and they were becoming more exhausted because they were working hard to breathe. By correcting that, actually their ability to play for longer and harder was improved. But also some of the feedback they got and we get now from our screening programs is people feel fresher and more clear of thought. We had one of our players saying that he just feels less exhausted and able to make more decisions with regards to his final ball and such like at 85 and 90 minutes. There's a huge impact in our screening program. So one of the things we do is screening programs at the league, but we also look after individuals who have episodes of breathlessness. Sometimes they feel that there is more in the engine than their breathlessness allows, and therefore we assess that, we understand, and we assess whether it's the biomechanics of breathing, i.e. the lungs are great, the heart's great, but the voice box is shutting down. This is called inducible laryngeal obstruction, or there's an asynchronicity of their breathing pattern. And we have to use quite complex processes and real-time physiotherapy and cardiopulmonary exercise testing to assess that at the moment. But things like plethysmography and new technologies to assess breath-to-breath variations will be really important to understand that going forward. I think we then also assess people with exercise-induced asthma. We do quite a lot of work around that. And then obviously there's a group of individuals who have huge amounts of deconditioning. So we assess that as a cause of breathlessness. So our clinics are for all. We look after individuals from British Olympics, British athletics, Paralympians, the para swim teams, the UK swim teams. We've got Premier League teams, and we do a lot of work with Yorkshire and Lancashire cricket as well.
Amazing. What about like someone who's not an elite athlete, but they're maybe, trying to run once, twice a week, maybe go to the gym? Um, if you think about an average person like that, I'm sure, including myself, we still don't always breathe optimally. Like when people come to you, what are some of the, let's say, challenges that then probably affect their wellness and health long term if they don't change? Like what are the, let's say, key challenges you see when it comes to people's breathing?
So I'm going to take a personal process in that, and I'm going to talk about myself for a few seconds. So I've got exercise-induced asthma, and I've had it since childhood, really. And even through my junior medical training course, I didn't realize it because I don't wheeze. I don't really wheeze. I used to run and I used to think I'm just exhausted, and I couldn't do a 5K without having a stitch and being absolutely shattered. Cycling okay, I could swim okay, but I was always limited by my physicality. And I put myself into a study when I was a researcher age, and I did a spirometry for the first time, and this is now been qualified for quite a few years. And I found that I had very severe obstructive airways disease, but no symptoms of it. And I went to see the local, one of my colleagues who then started on inhalers, and now I take inhalers on a regular basis. But realistically, I don't have exacerbations. I don't have any symptoms, but I don't have. One of the first things I noticed within a year, I was running long distances, and I do a Sunday run for 2 hours, and that was, my breathing was never limited. It's my fatigability and my age and my physicality now that I truly understands that limits me more than anything else. So it's really interesting, the kind of people that come to see us. It's we have individuals who want to run better and want to be faster and fitter. So they want things like VO2 tests and VO2 max tests and assessments from their respiratory or their cardiac perspective to see how far they can do and what they can do further. We have individuals so one of the things that you always need to be aware of is that when you exercise regularly, you chew up nutrients and and so we all think about hydration and stuff like that, but nutrition and nutritional replacement and management is important, and also your physical health. So you and I know that, whether you're an elite athlete or someone who exercises regularly, sometimes you live in a precipice between being really fit and healthy and becoming unwell quickly and such like. So part of the process is that we ensure is that our individuals, when they come and see us, are nutritionally replete and don't over-exercise, and don't have
Mm,
fatigability due to that. And that's not where the breathlessness comes from. But a large
right.
proportion of our individuals come to us with breathlessness, and they sometimes are symptomatic. So by just having a discussion with them, the most important thing that you do as a medic is to talk to your patient. That initial consultation is by miles the most paramount thing that you do, because you learn loads of things. Effective history, you just let the patient talk. It will give you a diagnosis 9 times out of 10. You understand hopes and aspirations of those individuals, and you understand the best way to support them to get better. And that's the thing that we do. We support individuals to try and get back to where they want to be. So I think from our perspective, we have a multitude of reasons why people come to us. Sometimes they're really symptomatic. They've had a bad infection and they've just not recovered. Sometimes they want to be better. Sometimes they perceive they can be better, but they're limited and they don't understand why, and they feel breathless related to that. And sometimes it's about fatigability and such like. So, and it's trying to unpick the physiology and the pathophysiology from each other and trying to meld them into a process which works for that individual.
Yeah, that's beautiful. Maybe then let's talk about Albius. So we've kind of been dancing around the topic of technology a little bit, partly on purpose, but I think I reached out to you, this is like some time ago already, and you got intrigued. Do you remember, like, maybe even thinking back now, like, what is the thing that attracted you most? Like, what was the thing that made you like, oh, I want to learn more, or maybe even I want to join as an advisor, a medical advisor for these guys?
So, um, so I think it's one of the next horizons in health and well-being. So one of the things, I'm the head of a Severe Asthma Centre. So we look after the most severe asthmatics in our region. And one of the things we very often find, our patients are over medicated. And we not only look after the asthmatics, sometimes people have had a diagnosis of asthma because they've got vocal cord dysfunction and they've been misdiagnosed. So misdiagnosis, then putting on loads of steroids, loads of inhalers, which don't work, but people keep on piling on things. And actually, the most important thing in life is diagnosis, understanding what's wrong rather than medication. The medication comes secondary to that process, because actually the right medication has the most impact. But actually, is medication the right thing to do? And not in always, in all people. So why technology is starting to interest many of us, is it because it has potentially the ability to do multiple things for an individual and for the clinicians as well. It has the potential to support diagnosis. So for people and the clinicians to understand what's wrong before you treat. It has the potential to assess outcome of the things that you implement to make yourself better, because it's a sequential process. At the moment, we use things like questionnaires. Are you using more steroids? Are you using more inhalers? But actually, having technology demonstrate things are getting better would be amazing, because it's actually real time feedback to that individual. It's more likely to make someone more compliant to their well-being and to the things that they're doing to show them it works. The other thing that technology can potentially do is pick up disease earlier or pick up abnormalities earlier for individuals to correct it in their life without becoming unwell. So one of the things that globally we're struggling with is funding healthcare, aren't we? It's a challenge because technology and because of the drug productions and the medications, and people are living longer, and because there's more obesity in Western countries, in all of this scenario, there's problems. But actually, the question that none of us seem to want to answer or know how to answer is, historically, medicine's been reactive. Have disease, you treat disease. So then it becomes about treatment with drugs predominantly, yeah, or with surgery or such like. But we know from data that if you can pick up something early, there's potential to correct it. So why technology interests me predominantly is there an ability for technology in individuals, but also on a much more wider healthcare system basis and a global basis, to pick up the potential for illness and to correct that early with minimal medication? And will that improve healthcare of that individual so they're less reliant on being sick? Yeah. And more able to be physical. The most important thing in life for many of us is to be physically active. Because if you are physically active, you can control your weight better. You can control your blood pressure better. Your heart's more conditioned, your muscles more conditioned. We know the data around anxiety and depression. The more physically active you are, the less you are likely to have psychological ill health. So if we can promote individuals to be able to understand their well-being more effectively, and the only way I can see currently to do that is through the ability to pick it up through technology, because it's and things like AI may help as well. Yeah. But I think that those things are going to be important. So that's why technology interests me. It also interests me because it is a potential way of tracking outcome, whether it's of medication, whether it's of, processes of care that you put in, which are more holistic. And it also allows us to understand how a certain disease process, improving that, potentially has an improvement in the whole well-being of that individual. Because at the end of the day, we're not organs, are we? We're not a lung, we're not a heart, we're a human being who has psychological, spiritual, and physical needs, and how that impacts on you as an individual. So, in a snippet, to me, it's part of the next processes of trying to improve the well-being of an individual, but also of a nation, if possible.
I can relate to the mission there. Definitely, it's like being able to do stuff earlier, catching and really giving independence and control is something I'm really excited about. And I can think back of what it was like for me, and what I imagine it's like for a lot of parents in the world as well. Is like that unknowing is the difficult.
If we know that 10% of footballers are asthmatic and don't sense asthma, the question is how many young children out there who struggle with sport and exercise due to breathlessness actually could we intervene in early, because we don't have the ability to find issues. And if we improve their outcomes early on in life, what would that look like for them, but also for the nation as a whole, with regards to healthy, well-being individuals who are able to provide a better outcome for your nation with work, with health, with regards to longevity, less utilization of healthcare, more productiveness within the workforce, but also individuals who are able to contribute to all the other social and art form processes that are important for us as communities and individuals.
Mm. Actually, that brings a thought. Like, I would love to hear your thoughts. I've been thinking about this, like, this old, three pillars of health. You have exercise, sleep, and nutrition. And typically, the way it's portrayed, which I think is to a large extent true, is that the keystone habit within those three is usually exercise, because when you exercise, then you actually want to eat better. You just feel that way. You kind of want to have a salad rather than a burger after a run. And then when you eat well, then actually sleep better because you've done the exercise, eat well. And so it becomes this like nice feedback loop. But I actually wonder, like, the more I explore this world of breathing, whether the actual keystone habit that could trigger the first one is actually breathing, because it seems like very often the difficulty people have with taking the first run is that they feel like, oh, I can't even breathe. Well, if you can train your CO2 tolerance and like the basic breathing stuff so that then your run becomes easier, or at least the perception of it is easier, maybe that could be the kind of the keystone habit that leads to exercise, which then leads to better better nutrition and then leads to better sleep. Just curious to hear what are your thoughts on that?
So it's really important. It's the one thing that we have real control over, don't we? The way we breathe effectively. How our heart beats, we can help it by conditioning and by exercising, but you need to be able to breathe and your muscles need to be active. The way your kidneys function is about your hydration, but we don't have the control of that. As an organ, your skin and your breathing are the two things that we probably have more control over and the ability to optimize more than anything else. And actually, you're quite right. So you take someone who has obstructive sleep apnea, whose oxygen saturations fall significantly at nighttime, who has abnormal, sleep disordered breathing. They are tired in the daytime, their memory is poor, their functionality is poor, they get heartburn, they're more likely to have metabolic disturbances like diabetes. Yeah, they have less ability to concentrate, So actually, that pathophysiology related to sleep disordered breathing at nighttime demonstrates if you can correct that, what actually is achievable. And actually, it gives you an indicator of having effective functional breathing and how important the delivery of oxygenation to the mitochondria in your body are wherever they are in your body is really important, because actually having effective breathing and effective gas exchange actually fuels everything you do. So it is actually, if you want to exercise, the more efficient your breathing is, the more efficient the delivery of oxygen into your end organ targets is, the more you're going to be able to exercise, the more able you're going to be physical. If you have effective breathing at night and throughout your sleep patterns, you're probably going to be more refreshed when you wake up. So we know that asthmatics get tired because we go through a circadian pathway within our breathing. So there are times in the early hours of the morning where our airways are tighter and narrow, and we're more symptomatic to being symptomatic. That's why asthmatics very often wake up at night time coughing and wheezing early hours of the morning. So actually, you're quite right. The effective breathing is really important. And history tells us that, just because we're in this era of modern medicine and science, you go back generations and, over a thousand years, and the importance of breathing in yoga and to the whole well-being is still practiced to this day, because we understand that the core of your well-being very often is related to how you breathe effectively and
Mm.
efficiently. And I think you're right. I think, those three pillars are driven by the effectiveness. It's about, so if you take a deep breath now, yeah, and you take 2 or 3 deep breaths, what happens? Your heart rate comes down. Yeah. You feel more relaxed. Your muscles are less tense. You feel a bit more alive. And if you have your hand in your pulse, you'll see your heart rate is lower. You're more calmer. Your whole process is more efficient. And therefore you then you put that into a process whereby it's throughout your day, throughout the 24 hours that you have, then actually you can imagine what physiologically, how important that will be to you as an individual. Having
Mm.
lower heart rates, being calmer, being more effective. And we know that actually having effective breathing improves metabolic function, improves the core activities within your body. So actually, it's
That's
probably one of the
fascinating.
most important things to
Can you talk more about
focus
that?
on.
Like, what do you mean? How does it affect the metabolic function?
So we know that, so there's data, isn't there? So most of the data comes through pathology, pathophysiology. So you look at individuals that, for example, look at people that have sleep disordered breathing at nighttime. And because they have adrenaline surges, because they become hypoxemic on a regular basis, they have hypertension. They have, their adrenal axis is affected. That they have increased heartburn and the impact on acid secretion is impacted. We know that there is a potential for increased diabetes in patients with obstructive sleep apnea. And some of that may be due to lethargy and tiredness and obesity. We understand that, but there also seems to be an independent factor within that, which is related to the sleep disordered breathing, the hypoxemia that individuals have.
Hmm,
So we know that
interesting.
there are pathways and processes that our patients go through that undoubtedly impact on them on their well-being, which is related to abnormal breathing patterns. So one of the things that we see in our patients, for example, you can see the ability, because you work hard with inducible laryngeal obstruction, this is where your voice box shuts down. You get coughing, you get increased nervous activity, you get the ability not to breathe effectively, you get chest pain, and you get adrenaline surges within them, and there's a cortisol imbalance. There's a cortisol imbalance in patients with asthma. Now that may be affected because if you've got severe asthma, you're on and off steroids a lot orally if you're on the severe spectrum. So there are pathways, and there are probably pathways that we still don't know about, which lead to lethargy and tiredness and fatigability in this population. But we know that this is part and parcel of that process. We know that people with chronic lung disease, for example, have anxiety and depression. Now, some of that may be related to the fact that they've got chronic disease, but that chronic disease is driven by a respiratory component. Some of that may be due to isolation because they've got severe disease, they can't socialize. And some of that may be related to lack of physicality. But there is
Yeah.
also a question is whether that whole dysfunctional breathing, the impact and delivery of effective gas exchange is impacting on their, their kind of like ability to function and what that is having at a metabolic rating within their bodies.
Yeah, that's fascinating. I remember reading at some point that how the oxygen is basically driving the metabolism when we eat. And I'm just wondering if anyone studied actually like the impact of the way you breathe to the way you digest food. Do you know much if anyone studied that kind of thing, or like does it matter at all the way we
Yes,
breathe during eating?
some of that's outside my knowledge base, to be very honest with you, Patrick. But
Sure.
in fairness, we know. So, for example, we know that people with chronic lung disease, get more breathless when they eat. Yeah, because you get blood diversion to your gut, and naturally that removes, because your oxygen levels are lower, that removes blood to your vital organs, so you feel you struggle more after food. And we know that in fairness, that inability to breathe effectively also impacts on your digestion and your capabilities of digesting effectively. And also, we know that people with severe lung disease have respiratory cachexia. So they work so hard to breathe that they're in a positive catabolic state. So they chew up more energy than they can take in orally. So they are actually at a point where they are continuously in a starvation mode. So we know that, looking at it, that processes of activity which cause breathlessness may have an impact on your nutritional status. We know that the more harder you work, the more nutrients you build, you break up. And so when you look at these athletes, they have processes done. They replenish not only vitamins, but they replenish minerals like magnesium and potassium and such like in their diet because they sweat it out, they work hard. But that's all about working hard. And some of that is related, if you've got respiratory disease, to the ability that you're just having to physically work hard to breathe.
Yeah. Yeah, super fascinating. It's like everything impacts everything in our body. But it seems like this could be one of those levers, as you mentioned, we have control over, which then helps all those other things underneath that. Maybe one thing we haven't discussed, but I thought might be interesting to just touch on at least briefly is the COVID and impact it had, because I read somewhere that what's called long COVID, which I actually don't know how it's defined, but it's, I guess, things that you, or the impact of what COVID had on people, but then it continues having symptoms, particularly when it comes to respiration. And I'm just curious to hear, have you seen that still ongoing even now in 2025? And if yes, like, what are the ways people can combat that, like to live a full life when they have it?
Yeah. Gosh, that's difficult, isn't it? So my unit, so we run a respiratory high dependency unit in my hospital. When COVID occurred, we, as part of Department of Health assessment, we had some of the lowest death rates. So we had a unit whereby people were not intubated but non-invasively ventilated. Some of my team did some of the seminal work around what pressures people needed and the oxygenation delivery to keep people alive through those acute COVID periods, especially before the vaccine became available. And we noted that COVID was a systemic disease process. So people had blood clots a lot in the first wave, where and the bloods were thickened, and we were looking at anticoagulation pathways and such alike. We knew that people had severe confluent shadowing, very often being asymptomatic, but then they became symptomatic within their lungs. We knew from the data that was coming out of China that people had heart disease. So we knew COVID was not a lung disease, but a systemic disease. It affected nearly every organ, predominantly through an inflammatory process, which caused huge amounts of damage, including your central nervous system. I think what we were not prepared for was a sequelae of COVID. We were thinking about people with fibrotic lung disease or impacted myocardiums, but actually the outcome of long COVID and the impact of that on many individuals has been documented over many years. It's fair to say that the investigations, the follow-ups, the diagnosis of long COVID has not probably been where it needs to be globally. I don't think people who've had long COVID have had a fair shot. I don't think monies have been put into the definition of it, the causation of it, the treatment of it, the accessibility to treatment of different presentations of it. And I think therefore, especially in our country, but you look at the world around you, people have struggled with outcomes. I think there's been an undoubtedly psychological outcome of COVID, both acutely and chronically. I think many people have never witnessed the potential of losing life and their own life at an early age through no fault of their own, but by picking something up. And I think people have psychologically been scarred by the impact of it and of being so unwell. And I don't think there's been much help for those. So long COVID in many ways is a multifactorial thing to many people. There are definitions of it, but I
Hmm.
think people interpret it in different ways. I think people interpret it as a sequelae of that pandemic, whether they were badly impacted or the impact it's had on their well-being after that. And I think, but there are undoubtedly people who have increased fatigability, cardiac dysarrhythmias, who've got significant breathlessness in the presence of normal lung physiology. And one of the things we have to understand about physiology that we undertake, it's limited. The lung physiology that we take in modern medicine doesn't give you all the answers. So it's wrong to think that you come to a lung function unit and you do some glowing testing and it will give you a diagnosis. Because there is undoubtedly a cohort of patients, it will not give you a diagnosis, but you see patients who are symptomatic and clinically have a disease process, which a physiology does not prove. In the vast majority, it will do that. It will give you an idea of diagnosis, may give you an idea of severity as well, but not in everyone. And we know that we've had individuals with normal lung physiology, for example, but when they've done helium MRs and stuff like that, they've shown significant vascular abnormalities affecting gas exchange. So I think when you extrapolate that into the long COVID process, there is undoubtedly a group of individuals that struggle with fatigability. which is muscle and oxygen delivery and related. There's individuals have developed abnormal breathing patterns, so breathing pattern disorders,
Mm.
which our physiotherapists have worked with to try and resynchronize how they breathe. So actually the physiology is normal, but actually when you look at the way they breathe, it's become abnormal. And that's because they've had an acute viral insult or maybe a secondary bacterial insult to their lungs, which has rearranged how they breathe normally. Rather than having an
Mm.
expansion of their lungs and a lowering of their diaphragm, which produces a huge vacuum within your lungs to suck air in, you've become asynchronous. So your breathing's become abnormal. And the only way we've been able to do that and understand that currently is by our physio seeing them. And we know that after viral insults, sensitization and development of disease processes like asthma increase. So I think
Right.
in people with that, and then there's the whole issue of brain fog, fatigability, poor sleep, and there are more unknown questions. So now, a few years down the line, we don't see patients currently being admitted into our high dependency units, our intensive care units with acute COVID. The presentation of long COVID is less frequent to our front doors, so we don't see as much of it. I
Hmm.
think people have rehabilitated. A lot of people have improved, not everyone, but a
Yeah.
significant people have had time for the body to recover. The body does recover itself, which is a miracle that it performs on a regular
Amazing.
basis. So I think we see less long COVID coming through the front door. There's no doubt about it. I think individuals have found long COVID units where they've tried to find practitioners, and I think there is a proportion of people who've given up. So they don't come and see clinicians anymore
Right.
because there is very little data, there's very little treatment options, and actually there's very little for them to access to help them currently. And the question realistically is, a lot of us don't know exactly what pathophysiology we're trying to sometimes deal with because there's so many symptoms in some of our patients.
Hmm. Yeah. I mean, I
I
sensed
mean,
when you started
the
talking about
sequelae of
COVID,
it.
there was this sadness in your voice. I can only imagine what those years were like
Yeah.
from your perspective.
So honestly, they were initially scary because we were going into the respiratory concerns, and our nurses in particular and our physios in particular were doing secretion management. So, and we just did not know where we were going into. So, and we all, I mean, I made sure my rules were sorted and stuff like that because I didn't know what was going on and the wording, and PPEs were disparate and stuff like that. And actually, in hindsight, people like myself were well protected because we had, even dealing with acute COVID patients, we had we had masks and gloves and such like. It was our bus conductors, our porters, the people who dealt with our day-to-day populations without any protection who were really at risk, and it was poor. It was a disease that impacted the poor more than anyone else because you live in housing together, you live on top of each other, you have to take public transport, you don't have the luxuries of working from home very often. So those individuals had high infective burden exposure. So there is a sadness in my world because it shows a disparity within people who are vulnerable and who aren't. It also There is sadness because actually as clinicians we try to do the best we can, but I think as soon as the acute phase went away, those individuals who are sometimes and continue to be impacted haven't probably been treated as well as they should have done. And there's some of them always feel that it feels sometimes that there is a population globally that have been left behind.
Maybe to end on a more positive note, if you think about someone who's listening who, let's imagine they don't have any respiratory disease. They're, generally healthy, maybe a little bit out of shape, as most of us are. But what is your advice for them when it comes to, if you think about like nutrition, we all have these kind of clear guidelines, like eat vegetables, eat enough protein. There's like, pretty clear guidelines. Everyone knows kind of roughly what to do. The question is, do we actually do it? But I think with breathing, it's a bit less clear. Like, what does good look like? If you could just kind of design almost like a protocol for a normal human out there, like what would that look like from a breathing perspective?
Gosh, to live well, that's the most important thing. Yeah. We've got finite time in the world. Live well. Yeah. Physically and mentally and spiritually, live well. I think that's really important, isn't it? So I think, but the question then is, what does live well look like to you and I and to anyone else out there? Because we have all different ideas of what living well is. And we have different proportions of our spirituality, our psychological well-being, and our physical well-being. I think understand your body is really important because we are all made of different physiological stuff. We ectomorphs, endomorphs. Some of us are never meant to be skinny models, and some of us are going to carry a bit more bulk. But that's your life, and but you can do stuff that other people can't. You can move boulders, for example, where other people struggle with that. You have a strength in there. So I think what I would suggest is to understand what your physicality is. So we now have things like Apple Watches that give you heart rates, that you can do an ECG on, tell you abnormal heart rhythms and stuff like that. Actually, we have mindfulness in our watches, in our phones. So we're moving that way. We have patches which talk to you about your glycemic well-being. Actually, we went through this initially, didn't we? We talked about how important breathing was to center you. We did that, 2 or 3 deep breaths in. What does that do to you? How do you feel after you've slowed everything down? You taken 2 or 3 deep breaths in. You found your pulse rate reduced. You found the muscle tension reduced in your body. You found that there was more clarity of thought. You felt more relaxed. Those are all physiological processes that go on in your body, which effective breathing allows you to do. So actually, if we can have technology that allows us to understand how to control your breathing, how to make your breathing the central pivotal part of where you are, almost it's your yoga teacher with you all the time. Now, I don't think you probably can do it through a wristwatch because you need something on your chest, which is non-intrusive but allows you to be effective. But I think if we can do that, it may, even if it's not all the time, it may allow us to control ourselves. So imagine you're really het up. You've had a confrontation and your watch goes off saying, you need to slow your breathing down. What happens when it does that and you listen to it? What does that do to you? What does that do to confrontation? What does that do to you? And what does that then look like in the evening? Are you still kind of like angry, or have you calmed down because you've been able to stop that earlier? What does that do to you long term, being able to do that? What does being able to breathe effectively? So we all breathe, but do we all breathe effectively? And I don't know the answer to that. I would argue that my clinical experience is that not all of us breathe as well as we should do. Even the best of us don't. There are times when we can breathe more cohesively, more coordinated. So the question then becomes is, if we can understand how to breathe more effectively, does that allow us to exercise more efficiently? Does that allow us to be more calmer at times? Does that allow us to be centered more? And does that allow us to be well at this moment in time? And if you're well at this moment in time and you can carry that on for 5, 10, 15, 20 years' time, what does that do to your brain? What does that do to your heart? What does that do to your blood pressure? What does that do to your kidney function? And I go back to the yogis, of all, to me, that they understood something very kind of like essential to well-being, that actually yoga is a part of many people's lives because it allows you to center your ability around your breath pattern. And your breath pattern then allows you to center your physicality and your well-being. And it's not just about improving your well-being with regards to exercise, but it's about the whole physical journey and the psychological journey that you go on. So to me, when you're thinking about the future, you're thinking about yourself as an individual, you're thinking about what can we do? What can technology do? If we can understand how we breathe, how we can improve our breathing, what does that do to you as a human being?
So I think a beautiful way to start closing. Just thank you so much. Every time I talk to you, I feel like I learn a lot, and I'm sure we'll do a round 2 at some point. But for now, thank you very much for joining us today. And for everyone listening, we'll be definitely adding a few show notes. You can check, for example, the Elite Breath Clinic and a bunch of other things we've mentioned there. But thank you, Aashish, for what you do.
Thank you, Patrick. Thank you for having me. It's been a pleasure.